Justice, and I'm here today with Dr. Patricia Salber, board-certified internist and emergency medical physician. She is the creator and editor of the blog, The Doctor Weighs In. She's a principal at Zia Healthcare Consultants, and she's also founder and CEO of Health Tech Hatch, a resource dedicated to launching early-stage innovations in healthcare and putting them into the hands of healthcare professionals, patients, and consumers. Dr. Salber, tell us a little bit about your experience with startups and the mission of Health Tech Hatch. What do you do at Health Tech Hatch?
Sure. Well, let me just tell you why I decided to found the company. As you mentioned, I'm a physician. I practiced emergency medicine at Kaiser Permanente for a long time, and then spent another chunk of time working on the insurance side, the business side of healthcare. And a couple of years ago, just as this M-Health revolution started to get very hot and almost frothy, I decided that that's what I wanted to do for the next phase of my career. And I started going to meetings with entrepreneurs and saying, hey, what do you need? How can I help? And they said, well, it's pretty simple, Pat. I need two things. One, I need money. What startup doesn't need money? And the other is, it's really hard for me to connect with doctors and patients so I can get feedback and test my app. So being an entrepreneur myself, I said, well, I can do that. So that really was the genesis and the mission of Health Tech Hatch, which is to help healthcare entrepreneurs, startups, be successful so that they can get their innovations as early as possible into the hands of consumers, patients, and doctors.
Mm-hmm. Yes, and I heard that you've just joined forces with Indiegogo. So why did you do that, and how is that working out?
Well, that's a great question. So we rolled out our first service, which was crowdfunding, on October 8th, which was the first day of Health 2.0 last year. And we built out our own platform, and we successfully crowdfunded a number of projects. And we learned a lot from that. In fact, we have debriefed with every one of our entrepreneurs, and so we came to understand the strengths and the weaknesses of being a health care vertical crowdfunder. And I had an opportunity to be on a panel with the people from Indiegogo who are crowdfunding for my alma mater, UCSF Medical School. And I'm sitting between UCSF and the guy from Indiegogo, and literally this light bulb went off. I mean, I could almost see it as I was up on the dais, saying, what on earth am I doing? Why not partner with Indiegogo? Who has lots of traffic, has generated some huge amounts of money for some, not all, but some of their campaigners. So why not take what we do well, which is everybody at Health Tech Hatch has deep expertise and lots of connections in the healthcare world. Why not combine that with the crowdfunding reach of Indiegogo? So I called them up and we had some discussions, and we just completed forming a partnership. So now when people come to crowdfund with us, Health Tech Hatch, they'll get the stamp of approval of Health Tech Hatch. They'll have access to the health expertise of our company. They can buy wraparound services if they're interested to help them develop the campaign, strategize about their videos, help them design the rewards. But they actually, when they post their project, it is posted on an Indiegogo Health Tech Hatch partner page. So they get the reach of Indiegogo. And it seemed to us that this was providing our customers, the entrepreneurs, the best of both worlds.
Yeah, great.
And by the way, it doesn't cost any more to crowdfund on our site as a partner of Indiegogo than if they went on Indiegogo without coming to our site.
Great, Pat. What about the Blue Button Challenge? Tell us a little bit about that. I just reposted one of your posts last week. How's that going?
Sure, great. Well, it's going fantastic. And just to back up and let anybody know who's watching that our other service line is to bring patients, doctors, and caregivers together with developers so they can iterate using our website asynchronously as the developer is actually developing their innovations. So they can do a narrative. If it's an early concept, they can upload screenshots as they're building out the screenshots of their app, or they can link people over to their website if that's the way they're providing their service. And we did our very first end user project with Health and Human Services in November for the healthfinder.gov app challenge, and it went really well. And it actually was a requirement of the challenge that the developers post on our site. So I think that means our name was in the Federal Register. They post on our site and obtain feedback, and then show to the judges what they did with the feedback. You know, how the experience helped them to develop a better app. And the idea was that if end users helped you with the development, that the app may be more likely to actually be used. Because we know one of the issues in this field is that there's, I don't know, 20, 30,000 apps out there for healthcare, and most of them are never downloaded. And if they're downloaded, they may be used once or twice, but they're not sustained. And so we believe that part of the problem is because people are developing it without really understanding what it takes to have an end user get engaged with the app. So we completed that, I believe, in February, and then about a month ago, Health and Human Services, specifically the Office of the National Coordinator, came to us and asked if we would provide the end user testing platform for a new challenge, which is so cool. So I'm going to just take a second and tell you, because I think what they're doing is absolutely incredible. They've decided what they want to do is to take the blue button, which is a way that people can download their healthcare information. It started out at the VA, but now a number of healthcare organizations have incorporated blue button technology so that patients can actually download their healthcare information. Now, how's that for a thought? You can actually get your information. But this challenge is to design tools, apps, but it doesn't have to be apps. It could be other kinds of tools that will take that information and turn it into actionable information. So there's a difference between knowing what my blood glucoses are over the last 5 years. I know that. I get them once a year. I know how I can see how they progress. And taking that information and actually putting it into a tool that would help me to manage my blood glucose better, or manage my blood pressure better, or whatever the issue is. And ONC, this is the part that I think is absolutely brilliant, decided that they were going to crowdsource the ideas that will stimulate the developers to develop around those ideas. And they've done that on our platform. It's called ideas.healthtechhatch.com. And over the course of almost 2 weeks, it ends tomorrow, people have been able to come to the site and post their ideas. So they finish the sentence that says, I want to see built a tool that will, right? And then people fill in the blank. And then folks can come on and vote for their favorites.
That's so cool.
I mean, it's very cool. So we're not quite at 2 weeks, and there have already been almost 4,000 visitors to the site. And there are 79 ideas that range all the way from, hey, I want to get the data from my implanted defibrillator, to I want to be sure that you know more about me than just my health data. I want my friends and family to be able to come in and incorporate personal comments about me and my life. So a whole range of great ideas. The ONC people are going to narrow down those 79 ideas to about 3. There's so many, they may decide to do a little bit more, and then they will put those out to the developer community. And the developers will start to design their tools around the guidance of those ideas in the context of this is a blue button challenge. And then they will upload their projects, hopefully in the really early stages, even if it's just narrative. Mm-hmm. And we will bring in patients who will start iterating asynchronously, or if they prefer, by phone or Google Hangout or something like that, or Skype, over the course of the development cycle, which is about 5 weeks in the case of this challenge. And the response has been amazing. We put out a call for people who wanted to volunteer to be testers. We are paying the testers. This is another innovation. Mm-hmm. We're actually going to pay testers $50 an hour. Wow. Because their time is valuable, their thoughts are valuable, and they ought to be paid for it. But we're limiting people to 2 hours so that we can have enough variety. Uh-huh. You know, we have a budget that was approved by ONC. And so we're hoping that we will get somewhere between 30 and 50 people who will come on and give feedback to these developers. And if that wasn't enough, great. At the very end of the project, we'll crowd vote the winner. So, I mean, this is really about patient and consumer engagement in the development of these solutions from the beginning to the end. What could be greater?
That's great. That's great. In a couple of words, Pat, what's the best advice you can give a startup?
Well, come crowdfund with me. Test the project early and often. But besides that, I really think there's two things, and it all comes out of this lean startup movement. I think you need to be both perseverant, stick to it, mm-hmm. even when things feel like a big struggle, and they will as you're a startup. I'm a startup. Mm-hmm. But be flexible. Mm-hmm. So both persevere and be flexible. We started out with one idea, and to use the jargon of lean startup, we had to pivot, and then we had to pivot again, and pivot again. Mm-hmm. And eventually you'll hit on all the pieces that work. So I think that's the best advice I could give, although it's not my original advice.
Well, thank you so much, Dr. Patricia Salber, for this great advice. And I look forward to hearing more about Health Tech Catch in the near future. Thank you so much.
Thank you, John.